Hey guys, welcome back to my new video. So without any further delay, let's get into it. So basically today's video is all about musculoskeletal. So I will teach you how to perform the OSCE examination of the musculoskeletal. So the things you should know when you are performing the musculoskeletal is you are asking the patient about pain, and you are also seeing the expression of the patient when you are palpating the patient's musculoskeletal structures. Hi, I'm your Dr. Bhavani Singh. Can you please tell me your name and age?
Rahul 22.
Okay, so today we are gonna examine your musculoskeletal, which includes shoulder and knee. So is that okay for you?
Yeah, okay.
Thank you. So first we will start with knee examination. So can you please walk for me? Okay, so when patient is walking, so you will check the patient's gait. So when patient is hitting the heel on the ground, so at that time patient's knee should be fully extended. Okay, thank you. So now we will do the inspection. First of all, we will ask to the patient if he had any surgery or something like that. So did you have any past history of the joint surgery?
No.
Okay, so we will start with the inspection. So in the inspection we look for any atrophy, fasciculation or any swelling or scar, something like that. So fasciculations are any involuntary movements of the muscles, and atrophy is wasting of the muscles, and swelling is, there would be an bulging in the knee if there is any swelling or there is no scars. Now we will palpate the anatomical structure of the knee joint. So first of all we will start with patella, and then we will move downward to the patellar tendon, to the tibial tuberosity, and then tibial condyles, and then femur epicondyles. Now medially there is condyles of the femur, and downward there is tibial plateau, and between the joint there is menisci, lateral and medial meniscus, and from the epicondyles of the femur to the fibula there is lateral collateral ligament, and medial side there is medial collateral ligament. Okay, so we are done with the palpation. So now we will do the range of motions of the knee joint, so which includes, there are 4 range of motions: extension, flexion, internal rotation and external rotation. We are starting with flexion. So can you please move your leg backward? So this is flexion of the knee joint. Can you please straighten your leg? This is extension of the knee joint. Okay. Can you please lift your leg to the midline and move inward? So this is internal rotation. Can you please move outward? So this is external rotation of the knee joints. Okay, so now we will perform the 3 special techniques to know if there is any edema in the knee joint or not. So we will start with minor, which is bulging. So for that you will milking the patient's thigh, and you will come downward to the knee joint, and you will press at the knee joint medial to the lateral, and you will tap to the lateral side, so and see the if there is any fluid accumulation or not. So this is bulging for minor effusion. And the next is ballooning. So for that you will milking from the upward and from downward towards the knee joint, and you will make a balloon, and then you will tap inside the balloon and see the movement of the where you are pressing. If this is coming out slowly, then there is edema, otherwise no. So the next is ballooning. So for that you will press superior to the patella and remove suddenly and see the movement of that location where you pressed. So if the location where you pressed is coming slowly out, then there is chances of edema. So we are done with special techniques to know edema. Now we will perform the maneuvers. Now we will perform the joint line tenderness. So for that you will flex the patient's knee to the 90 degree and it should be in your hand. So, and you will make a internal rotation and ask the patient if you feel any pain.
No.
Okay. And for that you will change your side to other side and you will make a movement of the external rotation and ask the patient if he feels to the lateral side. Okay, so this was for joint line tenderness. Okay, so now we will do the first maneuver, which is for meniscus McMurray test. So for the McMurray test, you will hold the patient's knee joint like this and patient's heel from your right hand and some flexion of the knee joint. And when you are checking the patient's medial meniscus, you will rotate inwardly and you will pull patient's leg towards your side and make a movement of the flexion and extension and ask the patient if he feels any pain.
No.
Thank you. And for lateral meniscus, you will change your side to other side and you will perform this maneuver same. Okay. So there is one more maneuvers for meniscus, which is Applied Grand. So for that you will make the patient to prone position. For that you will flex the patient's knee and you will put your leg on the patient's thigh and press on the patient's heel and you will make a movement of inward internal rotation and external rotation and ask the patient if he feels any pain.
No.
Thank you. So this was Applied Grand for meniscus. Okay. Now we will perform for the cruciate ligaments. So for cruciate ligaments there are 3 tests. 2 is Drover test and 1 is Lachman test. So there are 2 cruciate ligaments, anterior and posterior. So we will first perform Drover test. So for Drover test, patient's knee should be at 90 degree and you will put your leg on the patient's foot and you will hold the patient's leg like this. Your thumb should be at the soft part of the knee joint and you will jerk the patient's leg towards you and see the movement of the femur, forward movement of the femur. This is anterior, this is for anterior cruciate ligament, anterior Drover test. Now we will perform for the posterior cruciate ligament. So for that same position which was in the anterior cruciate ligament, so you will push backward and see the femur's movement for backward. So this was for anterior and posterior ligaments, anterior and posterior cruciate ligaments. So one more test for anterior cruciate ligaments, which is Lachman test. Now we will perform the Lachman test for anterior cruciate ligament. For that your position should be like this and patient's knee should be at 15 degree, and you will hold the femur of the patient and you will make a movement, upward movement of the leg. So this is for anterior cruciate ligaments, which called Leishman test. Okay. So now we will check the patient's collateral ligaments, medial and lateral collateral ligaments. So you will flex the patient's knee of the 30 degree, and this is for medial collateral ligament, which is called valgus stress, and you will press to medial side and pull the leg to outward and ask the patient if he feels any pain.
No.
Okay. So same, you will change your position to other side and you will repeat this formation. So this was for medial and lateral collateral ligaments. So medial is valgus stress and lateral is varus stress. Thank you so much guys for watching my video. So this is first part of this video and I hope this was helpful for you. So please hit the like button and subscribe to my channel, and I'll see you in the next video.